struggle with feeling hangry, especially if you haven't eaten for several hours? You feel brain foggy, tired after you eat, or even having trouble losing the weight from your midsection? Well, you'll want to stay tuned because you may have a condition called insulin resistance. Even if your A1C is normal and your blood sugar is normal, this does not rule out that you don't have an issue with your blood sugar. If you do have insulin resistance, you want to address it now because if you don't, it can lead to other chronic diseases such as prediabetes and diabetes, PCOS, osteoporosis, and many other conditions, even cancer. But the good news is you can start reversing insulin resistance. And in this video, I am going to go over what insulin resistance is, the test you need to know if you have it, and 4 steps that you can take to help reverse your insulin resistance. Hi, I'm Dr. Barr. I'm a double board certified family medicine and obesity medicine physician. I'm also certified in functional medicine is insulin resistance. Anytime that you eat, especially carbs, your body breaks that down into simple sugars. The sugars go into the bloodstream, and that triggers your pancreas to produce insulin. The insulin then takes the sugar to your cells because the insulin is like a key to unlock the doorway of your cell so that sugar can go into the cell and your cell can use it for energy. If you're eating a lot of processed foods, then your cells may be getting overloaded with the sugar and may not need any more. So what happens is when you are insulin resistant, your cells don't open the door when insulin comes knocking. So insulin is trying to take the sugar into the cell, but your cell doesn't want any more because it's already overloaded. So your pancreas makes more insulin and pumps more out so that insulin has a whole entourage to try to knock down and bang down the door of your cell. And the cells finally give in and they open and they take the sugar. Your blood sugar may actually look normal even though you are starting to have trouble processing your sugars because the insulin is taking the blood sugar and putting it into your cells, then the sugar in your blood is dropping. And when you have low blood sugar, that's going to make you feel tired, brain foggy, and yes, even hangry if you haven't eaten. In order to feel more comfortable, you start eating more of these foods that are triggering the insulin. Over a period of time, the high levels of insulin, because they cause inflammation, will actually damage the cells in the pancreas that make the insulin. And so over a period of time, your body just can't compensate and can't make enough insulin. And that's when you start to get in the pre-diabetic phase and then the diabetic phase. Now, most conventional doctors will not check for insulin resistance. They will only check for pre-diabetes and diabetes by checking an A1C and your blood sugar. Insulin resistance is becoming more recognized, but it's still not commonplace to check for it. So you may get a false sense that you're doing okay because your A1C is good and your sugar might be 85. But in reality, if you have high insulin levels, you are not in the safe zone. You want to ask your doctor to check either a fasting insulin or some labs have what's called an insulin resistance score, which will also give you your C-peptide. C-peptide is a number that tells you if your pancreas is starting to burn out. So if you have plenty of C-peptide, your pancreas is still able to make insulin. But if it's on the lower end, then you're definitely headed towards the danger zone of becoming pre-diabetic and diabetic. Doctors can also calculate something called a HOMA-IR score, HOMA-IR, from your fasting insulin and your glucose. There are calculators you can plug in the numbers and it comes up with whether or not you're at risk for insulin resistance. Another way you can tell is looking at your waist to hip ratio. So if you measure your waist in inches and if you measure your waist and you divide it by the measurement of your hip, and in women, if it's higher than 0.85, or in men, if it's higher than 0.9, then you are most likely insulin resistant. You also may notice skin tags, darkening under the arms or around the neck, and those can also be signs. What can you do to reverse insulin resistance if you have it? Number 1, the most powerful step you can take to reverse insulin resistance is to change your diet. You really want to cut down on your refined sugars, processed foods, excessive refined carbohydrates, and certain ingredients like high fructose corn syrup. These foods cause your insulin to spike up quickly. If you're eating them a lot, you will have chronically elevated insulin levels, causing you a lot of inflammation and increasing your risk for chronic disease. Now, I know if you're eating the standard American diet, it can be very challenging to go cold turkey. You don't want to do anything drastic because then you may tend to rebound and you'll get frustrated because you feel like you can't stick to anything. But work with a healthcare provider or nutritionist or dietitian so that you can start to slowly make changes. Over time, you can do wonders to lower your insulin resistance. And sometimes this can even happen in as little as 2 to 4 weeks by even just adding certain foods. Adding healthy fats and protein and fiber can help make it easier to cut down on some of these processed foods. In fact, they have found that even adding some healthy fats can help lower insulin resistance by 60%. The second strategy is to incorporate some sort of intentional movement through the day. Adding exercise can do wonders to help balance your blood sugar. If you do it after your meal, it can even help reduce the impact of any excess sugar in that meal. Now, if 15 minutes seems too overwhelming, you can just start with 1 to 5 minutes and increase as you feel fit. But you eventually want to aim for 30 minutes. In fact, walking after meals may even be better than just doing it at another random time when you haven't eaten in terms of your blood sugar balance. You also want to add strength training about 2 to 3 times a week. Again, if you're not doing anything, you can just start with adding one exercise. So it doesn't have to be a long, drastic thing, but all of these little movements can add up in your day. There's a lot of exercises you can just do with your own body weight, and if you Google body weight strengthening exercises, you will find a ton. Of course, work with your doctor before you start on any exercise program to make sure that you are healthy enough to do that. Research has even suggested by adding strength training, you can really reduce your insulin resistance. Another strategy to help you reverse insulin resistance naturally is to try time-restricted feeding. Having a period of time where you're not eating will actually maintain your insulin levels and reduce the insulin spike. Thus, your blood sugars are more even, and you also become more what we call fat adapted, where your body learns to use fat for fuel, which is a much more efficient energy source. What time-restricted feeding is that you have a certain period of time where you are not eating, and then a period of time where you eat. A good ratio to start out with is 12 and 12. You would have an eating window for 12 hours. Now, it doesn't mean that you eat constantly for 12 hours, but when you eat your meals, it's going to be within the 12-hour period. So, for example, if you're doing a 12 and 12, you might start breakfast at 7, eat lunch at noon, and then wrap your dinner up around 6 so you can be done by 7 p.m. And then, because you're not eating until 7 a.m. the next day, you'll have 12 hours of not eating. So you can use the time during sleep as part of your fasting window, which makes it easier. But of course, again, check with your doctor. And if you are diabetic on insulin, you definitely want to work with your doctor because if you cut down on eating, you may think they don't have low blood sugar. The next strategy is to prioritize sleep. You really need to sleep 7 to 9 hours and get good quality sleep. If you don't, this will cause your cortisol to go up. And when your cortisol goes up, this will cause your blood sugars to go up, which then causes insulin to spike. So make it a priority to get good sleep. Have a good bedtime routine where you don't eat 2 hours before bedtime, no blue light devices an hour before bedtime. I would even avoid caffeine about 8 to 10 hours before bedtime. You also may want to get into a bedtime routine, a nice warm bath and shower, and some gentle stretching and breath work before bed. You also want to make sure the environment in your bedroom is conducive for sleeping. You can have blackout curtains or an eye mask so that it's dark. Also make sure the temperature is set about 55 to 68 degrees. That's optimal for good deep sleep. And then you also want to make sure there's not a lot of noise, so you may want to invest in some earplugs if you live near train tracks. One study found that just 4 nights of poor sleep can increase your risk for insulin resistance by 25%. The last strategy to help you reverse insulin resistance naturally is to try a supplement. Now, of course, you want to get permission from your doctor to make sure that it is okay for you. But there are some supplements that may actually help lower your blood sugar. The one that I found to be most effective and the one that's actually been studied against metformin is berberine. And you can do berberine about 500 milligrams to start. And then you can increase it to twice a day. But again, work with your doctor to make sure berberine is appropriate for you and safe for you. And you also want to make sure that you're getting a good quality supplement. So check with your functional medicine provider to make sure that the brand that you choose actually has in it what it says it has in it. Chromium is also another good supplement, and the dose is 200 to 500 micrograms daily. Another good supplement is cinnamon. Now you want to make sure you get Ceylon cinnamon, which is CEYLON. This form of cinnamon has less of an ingredient called coumarin in it. Coumarin can be toxic to your liver, so you don't want to get other types of cinnamon, such as coffee cinnamon, because those have higher levels of that coumarin. So you want to get Ceylon. 1 to 2 grams of Ceylon cinnamon daily can help balance your sugar. And you can buy these in a capsule if you don't want a whole bunch of cinnamon in your oatmeal or anything, although you could sneak it in place throughout the day, I suppose. Now, if you are diabetic, you want to definitely make sure you check with your doctor first before you add these into your regimen. I hope this video was helpful. I gave you some tools and strategies to help you lower your insulin resistance naturally. If you found this video helpful, please give it a thumbs up. That way I will know if this is a topic that you want to hear more about. And feel free to leave a topic in the comments if there's something that you're interested in. Have a fantastic day.